PET scans, an investigation into nuclear medicine. PET scans, otherwise known as positron emission tomography scans, are a type of imaging tests that work on the cellular level. The physics behind it. The atoms with more than 83 protons are unstable and will decay alpha particles. Lower mass nuclei that are stable have approximately equal number of protons and neutrons. The larger mass nuclei that are stable have more neutrons than protons. There are not stable nuclei with more protons than neutrons. The isotopes of elements that are radioactive have a lower neutron to proton ratio than stable nucleus. There are three main types of decay. One type penetrated only a small distance through the air. This is called alpha radiation. Another type that traveled much farther through the air is called beta radiation. The third type was similar to X-ray radiation, as it didn't have a charge, called gamma radiation. Now, we know that gamma radiation consists of high-frequency photons. In beta plus, or positron decay, a nucleon transforms one of its core protons into a neutron and emits a positron, essentially a positively charged electron and a neutrino. This happens because the atom has too many protons and needs to convert the excess protons into neutrons. The positron is the antimatter to electrons. In the case of antimatter, the particle's properties stay the same, however the charge is opposite. Anti-electrons, called positrons, behave like electrons, but have a positive charge. Antiprotons, as the name implies, are protons with a negative charge. Sometimes the antimatter has no charge. For example, neutrinos and antineutrinos have no charge. When a positron combines with an electron, it will annihilate, or recombine. In the annihilation, the electron and positron convert their mass into energy and produce a pair of high-speed photons that travel in opposite directions. The photon energy E comes from Einstein's famous equation E equals mc squared, where m is the mass of the electron and a positron, which is a very small number, and c is the speed of light, a very large number squared. This means the energy produced is high, therefore is part of the higher frequency of the spectrum, which corresponds with gamma rays. This annihilation radiation is what is detected by PET scans and what is used to form images of tracer concentration in the body. The tracer's positrons will annihilate with other electrons. Fast-growing cells have too many electrons. This means that there will be a significantly large amount of photon energy coming from these areas with too many electrons, thus meaning the concentration is higher. This process is called positron emission. When the positron and electron mutually annihilate in human tissue, the gamma rays are picked up by a Compton scatter. The photon interacts with an electron, ejecting it from its atomic shell. The photon experiences a loss of energy and an associated change of direction, typically away from the detector, and thus it cannot help with the image formation. Compton scatter and other interactions lead to the attenuation or makeup of the annihilation photons. This means that the photons that are lost will be accounted for. Attenuation is often a large factor in PET image quality. So, how do PET scans work? Well, 2 hours before your procedure starts, the doctor needs to create a tracer. In order to do this, he uses a device called a cyclotron to smash high-speed particles into ordinary atoms. This then transforms them into new radioactive atoms. They then use the cyclotron to make the tracer a biological molecule. The doctor chooses which type of molecule to use, sugar, protein, or hormone, depending on the bodily function being tested. The tracer is then purified to check if it will work as intended. Before the scan, you will be given a small injection of radioactive material. This is the biological molecule from earlier. You will then be placed on a scanning table and a scanner ring will be placed around the area being investigated. This is when the positron and electron mutually annihilate and release high-speed photons. These photons are then detected by the scanner and used to locate the area where the annihilation occurred, thus creating images of your internal body structures. Areas where the injected radiopharmaceutical gathers, for example, fast-growing cancer cells, appear brighter than normal tissues on the images. This is because cancerous tissue uses more glucose than normal tissue, because it's growing much faster and will accumulate more of the substance and appear brighter than normal tissue on the PET images. A PET scan is completely painless and the injection has no side effects. Sometimes you will be advised to avoid close contact with babies or pregnant women in a few hours after your scan. This is because you may still be radioactive. Some of the uses of PET scans can include detection and monitoring of conditions such as cancer, neurological disease, and cardiovascular disease. PET scans can create an image of the entire body. This means that for some cancers, they can show if and where the cancer is spreading into other parts of the body. PET might also be used to see if tumors are malignant, this means cancerous, and to tell the difference between an active tumor and scar tissue. PET imaging can provide information about the biochemical function of the brain. PET imaging has also been used to assess people with other neurological disease, including Alzheimer's disease and Parkinson's disease, because the images show areas of the brain that are functioning differently to normal. PET scans are used to assess both the blood flow to the heart and how the heart is working. This means that areas of the heart that have been permanently damaged due to reduced blood flow, for example after a heart attack, can be distinguished from those that are still working. The damaged areas may respond to surgical treatments such as coronary bypass surgery.